The initiative would mean a government in a middle-income country raising taxes on the product to push the price up from $4 today to $10 by 2035.
Disruptive.
Weird thing to happen. I don't know if people saw this. This is from the CBC. It says, raise prices on sugary drinks, alcohol, and tobacco by 50%. The World Health Organization suggests. The World Health Organization says higher taxes could cut consumption, support healthcare spending. But I thought we were, saving healthcare spending by giving out MAID pamphlets, right? That's the CBC reported that. Remember how much money we were saving on healthcare by not giving a damn about health of Canadians? Like, way to just try to save grace. Way to just turn that around to like, oh, I guess now we're going to try and care about Canadians. So this is kind of a bit controversial. And even for myself, scratching my head about this, because I understand, yes, smoking, alcohol, sugary drinks, yes. There's obviously a lot of things that are not healthy, that are not good for us, and we need to, as a society, curb away from that as possible. But is taxation, especially in Canadian means, because we're already taxed to death on so many other things, is that really a appropriate response to this situation? That, oh, if we just charge them 50% more, that's automatically going to make people healthier? To me, that doesn't seem like the case, but here's what they're suggesting. The World Health Organization is pushing countries to raise the prices of sugary drinks, alcohol, and tobacco by 50% over the next 10 years through taxation, its strongest backing yet for taxes to help tackle chronic public health problems. The United Nations Health Agency said the move would help cut consumption of the products which contribute to diseases like diabetes and some cancers, as well as raising money at the time for development aid is shrinking and public debt is rising. Health taxes are one of the most efficient tools we have, said Jeremy Fair, who Assistant Director General of Health Promotion, Disease Prevention, and Control. It's time to act, he says. The World Health Organization launched this push, which it called 3 by 35, at the UN Finance for Development Conference in Seville, Spain, who said that its tax incentive could raise up to $1 trillion US by 2035 based on evidence from health taxes in countries such as Colombia and South Africa. WHO has backed tobacco taxes and prize rises for decades and has called for taxes on alcohol and sugary drinks in recent years, but this is the first time it has suggested a targeted price rise for all three products. The WHO Director General, Dr. Tedros Adhanom, holy crap, how do you say that? Ghebreyesus, sure, told the conference that the taxes could help governments adjust to the new reality and bolster their own health systems with the money raised. Many low and middle income countries are coping with cuts to aid spending led by the United States, which is not attending the Seville conference. The U.S. is also on the process of withdrawing from WHO. So the thing that really strikes me is that this is coming from the same organization that claims that, hey, if we put these taxes on countries of these, sugary drinks and processed food and tobacco and alcohol, ignoring the fact that this is the same agency that is doing experimental vaccinations on people, that lied to you, that gaslight, that steal and fraud and are convicted of fraud, and are funded by people like Bill Gates. Is this really effective for health? Is this really effective for the health of nations? Do they really give a damn about securing the health and stamina of countries? Considering this is the same agency that wants to inject you with harmful substances, but then claim that they're going to ban sugary drinks. Like, it just seems, it's like apples and oranges. Seems so crazy. So here's just an example of what this is going to do. So it says raise prices from $4 to $10. As an example, the initiative would mean a government in a middle income country raising taxes on the product to push the price up from $4 today to $10 by 2035. Taking into account inflation, said the WHO health economist Guillermo Sandoval. Nearly 140 countries have already raised tobacco taxes and therefore prices by over 50% on average between 2012 and 2022, the World Health Organization added. So that's another point to add to this, is that here in Canada, we already have taxes on cigarettes. And this has been an initiative that they've done for a couple decades now. This is how they tried to wean people off from, cigarettes and tobacco and try to get off their habits and whatnot. And in some cases, it has worked. In some cases, it has worked that people just can't, can't afford to feed their addiction. So they tried to wean off it. But in a lot of cases, it doesn't always work because it's not about money. It's more about the addiction. It's more about smokers needing to smoke. The same way alcoholics, it doesn't matter to the price to them. They'll find a way to afford that drink because it's the addiction. So it just misses that point entirely. It misses that point entirely. And what you're basically doing is taking an individual with a condition of being addicted to tobacco or alcohol or any other even junk food that is not healthy for them or healthy for other people, and taking advantage of them and exploiting them for financing a agency that really has no promiscuity for health. Like the World Health Organization does not have the initiative, they don't have the agenda of, hey, let's talk about, naturalization. Let's talk about natural immunity. Let's talk about, vitamins. Let's talk about the importance of people getting vitamin D and vitamin C. They don't talk about that, but they'll talk about injecting people with these experimental vaccines done up in laboratories by people like Bill Gates. So that's why I'm a bit skeptical of this. That's why I think this is not a great idea. This is just complete overreach because it's not really effective in the means of a health sedative as it is just taxing people and using them in exploitative measures. That's where I see it. The other thing to point out is that this is not a first. This is not a first. So this person pointed out, Sharma, says the road to hell is paved with good intentions, Philadelphia edition. Nearly 2 years ago, Philadelphia passed a soda tax, a hefty 1.5 cents per ounce or $1 tax on a typical 2-liter bottle as a sin tax in the national war on obesity. Now the verdict is in. Goes on to say Philadelphians did not cut calories as a result of the tax on sweetened drinks, nor did they shift towards drinking anything healthier. Instead, most of them just drove outside the city to buy the same old sodas from stores where they didn't have to pay the tax. Meanwhile, the poorest in the city, those who can't find would find it hardest to drive for many miles to buy soda, just ended up paying more in taxes. We find no significant reduction in calorie and sugar intake, conclude researchers Stephen Steeler from Stanford University, Anna Tuckman from Northwestern, and Song Hyo from the University of Minnesota in a study published this week. Quote from the study, this tax does not lead to a shift in consumption towards healthier products. It affects low-income households more severely, and it is limited in its ability to raise revenue. As the obesity epidemic affects the poor disproportionately, they say the tax imposes a relatively larger financial burden on low-income, high-obesity households that are less likely to engage in cross-shopping at stores outside the city. They also note that this dismal outcome is widely at odds with earlier optimistic economic forecasts about how the soda taxes would fare. A variety of economists using spreadsheets and theoretical economic models predicted that taxing sugar drinks would lead to sharp falls in the amount of them that are drunk, especially by the poor, compared to the decrease of 51,000 ounces of taxed beverages at the average store in Philadelphia. We find an even larger increase of 61,000 ounces in stores up to 2 miles away from the city, the researchers found. Apparently, none of this was accurately forecasted using economic models. A tax designed to improve health of poor does no such thing, but instead just ends up enriching the city coffers by further impoverishing the very poor it was allegedly intended to help. So, they tried to do this in Philadelphia, and it didn't work out. And they also tried to do this in New York City. Remember this? New York City, under Michael Bloomberg, they had the soda ban that certain restaurants and delis, they weren't allowed to serve a drink that was, I think it was like 16 ounces or something. I forget the exact amount, but they tried this in New York. That, if you're going to go out, you're not going to have a sugary drink that's higher than a certain rate of ounce. But what did that do? That just meant people in New York City went to the convenience store. They went to 7-Elevens. They went outside of the city to just buy the drink anyway. Which, again, just goes to show you that these are meaningless. That it really has nothing to do with health. It doesn't have to do anything with the actual impacts that they could be doing for these poor areas, especially those in food deserts. You may have heard of that term, food deserts. And a lot of poor communities don't have access to fresh, nutritious food because they live in these food deserts. So maybe we should be focusing on that. Maybe put that money towards initiatives like that instead of funding the WHO, which we know the WHO is completely corrupted. So why would I trust them to initialize a taxation on the country of Canada that has already been burdened by so many taxes so that people can make healthier options? It doesn't make sense. It doesn't make sense. And that's why it failed in Philadelphia. That's why it failed in New York City. And no doubtably, it will fail in Canada. It will fail in Canada. Yes, there may be some small percentage of individuals that look at this and go, okay, I'm going to change my ways because it costs too much. But at the same time, it's not going to eliminate smokers. People are still going to drink alcohol. There's still people out there that have this addiction towards these products that are not going to be deterred by the pricing. In fact, it's going to cause more mayhem because if you raise the prices, that means they're going to have to find new measures to afford these habits that they're just going to do anyway. So it really just makes no sense. It really makes no sense. And even just for the sake of just the freedom of choice, what happened to that? The freedom of the consumer having the option to choose. Yes, I understand you want people to, go to healthier options, but endless taxation is not going to work. It's not going to work in the benefit they think it's going to work, because it hasn't worked in New York City. It hasn't worked in Philadelphia. They tried all over the place. It just always seems to end up short, and they want to make this nationwide in Canada. A, how are you going to enforce that? And two, it's not going to be the benefit that they think it's going to be. And you're going to put that money towards the WHO, one of the most corrupted institutions in health, next to the pharmaceutical agencies that are also aligned with the World Health Organization. So there's no burdens on them. There's no burdens on them after the disaster of COVID, after the disaster of after effects and all the side effects, which I can tell you they're very safe and effective. But you're going to go after individuals because they decided, hey, I'm going to buy a sugary drink, even though I know it's bad for me. I just decide, hey, I'm going to do it because of consumer choice. Like, it's just so unnecessary. Really so unnecessary that they do this. Hey, here at Kitz Corner, we want to thank you, our viewers and our subscribers that tune into Kitz Corner for the latest dives in trending news, political conspiracies, and the craziest of stories. However, being in this business isn't an easy job. Because we're independent, we can dive into stories that the mainstream outlets are afraid to do so. But unfortunately, that doesn't give us the luxury of big advertising or government subsidies. That's why we reach out to you. You can support Kitz Corner and get some cool new threads in the process. Say what? That's right, check out our merch store, where we have a big selection of t-shirts, mugs, stickers, sweaters, bags, and more. All with interesting designs too, like this True North Strong and Free. So if you want to show off your support, go to our website at kitzcorner.net. That's kitzcorner.net. And click the store link at the top of the screen. Or you can scan the QR code provided on screen to get instant access to our merch store. Your support makes a huge difference at what we do here. So why not wear your support too? So go to kitzcorner.net or scan the QR code on your screen to get to our one-of-a-kind Kitz Corner merchandise store. Thank you.